Diabetes myths are common misconceptions that can mislead you into poor health choices, often making it harder to control your blood sugar. These myths can prevent you from taking the right steps to manage diabetes effectively. In this video, we'll uncover the truth and help you regain control of your health. Number 1. Eating sugar alone causes diabetes. The belief that eating sugar alone causes diabetes is a myth that creates unnecessary fear and guilt. While sugar consumption can contribute to weight gain, which is a risk factor for type 2 diabetes, the reality is far more complex. Diabetes develops from a combination of factors, including genetics, lifestyle, and insulin resistance, not just sugar. This myth often leads people to demonize specific foods instead of addressing the bigger picture of overall health. Focusing solely on sugar can distract from the importance of balanced meals, regular exercise, and proper blood sugar monitoring. Avoiding all sweets while neglecting other unhealthy habits does little to prevent or manage diabetes effectively. Instead, focus on moderation, incorporate whole, nutrient-rich foods, and monitor portion sizes rather than cutting out sugar completely. By understanding that diabetes isn't caused by sugar alone, you empower yourself to make informed, balanced choices and regain control of your blood sugar and overall health. Number 2. Only overweight people develop diabetes. The idea that only overweight people develop diabetes is a damaging myth that can lead to complacency in those at a healthy weight. While obesity is a significant risk factor for type 2 diabetes, it's not the sole cause. Genetics, age, lifestyle, and even stress levels can play a major role. Believing this myth might make someone overlook early warning signs like fatigue, thirst, or slow-healing wounds simply because they don't fit the stereotypical image of someone with diabetes. This misconception can delay diagnosis and treatment, allowing blood sugar levels to rise unchecked. Diabetes doesn't discriminate. It can affect anyone, regardless of weight. Thin individuals who lead sedentary lifestyles, have a family history of diabetes, or experience hormonal imbalances are also at risk. Instead of relying on weight as the only indicator, focus on proactive health measures like regular glucose monitoring, balanced meals, and consistent physical activity. Awareness is the first step in protecting your health, no matter your size. Number 3. Diabetes can always be cured with diet alone. Believing that diabetes can always be cured with diet alone oversimplifies a complex condition and can set people up for frustration and failure. While diet plays a critical role in managing blood sugar and even reversing prediabetes, it's not a guaranteed cure for everyone, especially for those with type 1 diabetes or advanced type 2 diabetes. This myth can lead to feelings of guilt or inadequacy when diet changes alone don't bring about the desired results. Diabetes management requires a comprehensive approach, including regular exercise, stress management, medication when necessary, and routine monitoring of blood sugar levels. A balanced diet is vital, but it's one piece of the puzzle. For some, medications or insulin therapy are essential for keeping blood sugar in check. Understanding that managing diabetes is a personalized journey helps shift the focus from unrealistic expectations to creating a sustainable, balanced lifestyle that promotes health and well-being over the long term. Number 4. Carbs must be completely eliminated. The notion that carbohydrates are the enemy of diabetes management is a widespread misconception that can lead to unnecessary dietary restrictions. Carbs are your body's main source of energy, and cutting them out entirely can result in fatigue, nutrient deficiencies, and an unsustainable approach to eating. It's important to understand that not all carbs affect blood sugar in the same way. Refined carbs like sugary drinks and pastries can cause rapid spikes, but complex carbs found in quinoa, whole grains, and vegetables release glucose slowly, providing steady energy and valuable nutrients. Instead of eliminating them, focus on choosing the right types and controlling portions. Pairing carbs with protein or healthy fats can also help stabilize blood sugar. By embracing balanced nutrition rather than fearing carbs, you can take control of your health while enjoying a varied, satisfying diet that supports both your well-being and your blood sugar management. Number 5. Insulin is only for severe cases. Believing that insulin is only for severe cases of diabetes is a damaging myth that can delay necessary treatment and make managing blood sugar more challenging. Insulin isn't a sign of failure or that your condition is out of control. It's a tool your body may need to function properly. This myth can create unnecessary fear or shame around using insulin, leaving people to struggle with high blood sugar levels instead of taking steps toward better health. Insulin is sometimes introduced early to preserve your body's remaining insulin production or manage blood sugar effectively when lifestyle changes alone aren't enough. For people with type 1 diabetes, it's a life-saving necessity, not a last resort. Recognizing insulin as a supportive tool, rather than a symbol of severity, empowers you to embrace a comprehensive diabetes management plan. With the right approach, including insulin when needed, you can live a healthier, more confident life. Number 6. Diabetes is only about high blood sugar. The misconception that diabetes is only about high blood sugar overlooks the deeper, more complex impact this condition has on the body. Diabetes isn't just about managing numbers on a glucose meter. It's a systemic issue that affects multiple organs. Left unchecked, it can lead to heart disease, kidney failure, nerve damage, and vision loss. Believing it's solely about high blood sugar can cause people to underestimate its seriousness, delaying comprehensive care and risking long-term health. Managing diabetes goes beyond controlling blood sugar. It involves addressing underlying risks like inflammation, poor circulation, and insulin resistance. Proactive steps, such as improving diet, exercising regularly, managing stress, and monitoring overall health markers like cholesterol and blood pressure, are essential. Understanding that diabetes is a whole-body condition allows you to approach it holistically, protecting your overall health and preventing complications. It's about more than glucose. It's about safeguarding your future. Number 7. You'll always feel symptoms when blood sugar is high. The belief that you'll always feel symptoms when your blood sugar is high is a dangerous myth that can lead to complacency. High blood sugar, or hyperglycemia, often develops silently, with no immediate signs to alert you. This means you could be living with elevated glucose levels for weeks, months, or even years without realizing it. By the time noticeable symptoms like excessive thirst or fatigue appear, damage to blood vessels, nerves, or organs may already have begun. This myth can cause people to delay regular monitoring, assuming they'll know when something is wrong. However, consistent blood sugar checks are essential, even if you feel fine. A fasting glucose test or an A1C test can provide a clearer picture of your levels. By understanding that diabetes can be silent, you empower yourself to stay proactive. Regular monitoring isn't just a precaution. It's a way to take control and prevent serious complications before they arise. Number 8. Once diagnosed, diabetes will inevitably worsen. Many people think diabetics must completely avoid sweets, creating unnecessary fear and guilt around food. This mindset turns eating into a source of stress rather than enjoyment. While blood sugar management is crucial, labeling sweets as entirely off-limits is not only misleading, but also unsustainable. Sweets can be enjoyed in moderation with proper planning. Pairing a small dessert with high-fiber meals or protein can help reduce its impact on blood sugar. Opting for natural sweeteners or whole-ingredient treats offers satisfying alternatives without compromising health. Managing diabetes isn't about rigid restrictions, but finding a sustainable balance. By learning how to incorporate sweets responsibly, you can maintain control over your health while enjoying life's simple pleasures. Balance, not avoidance, is the key to a healthier and happier approach to managing diabetes. Breaking free from diabetes myths is the first step to better blood sugar control. Focus on balanced meals with 1 to 2 cups of non-starchy vegetables, half to 1 cup of whole grains, and 3 ounces of lean protein per meal, spaced every 4 to 5 hours. Incorporate 30 minutes of brisk walking or cycling, 5 days a week, and stay hydrated with 8 to 10 cups of water daily. Prioritize 7 to 8 hours of quality sleep and manage stress with deep breathing or yoga. By replacing myths with actionable steps, you can take control of your health and improve your overall well-being. You should also watch this video on other diabetes myths that are keeping your blood sugar high. And please subscribe to this channel if you find this video helpful. Thank you for watching.